A new spike in COVID cases. I'm Adrienne Pedersen today on Upfront.
It is not surprising as the state opens up more that we will see increases in infections as more and more people come into contact with each other.
Are we still making progress in the fight against coronavirus? For the first time since the pandemic started, we will have Health Secretary Designee Andrea Palm here on Upfront. Then restaurants reopening.
I've been waiting for this for 2 months.
Yeah, it's a very tough business right now. Our operators have really been through the ringer in the past couple months.
What the future looks like for your favorite spots. And state elections officials plan to dramatically increase mail-in balloting in Wisconsin.
Taking on the issues important to Wisconsin. This is Upfront with your host, Adrienne Pedersen.
Thank you for joining us. Wisconsin's seen a new spike in its COVID-19 numbers. In fact, the state last week saw its largest two-day increase in cases since the pandemic started. The higher numbers come as more of the state reopens, people are going out more, and in some cases, returning to the office. So what's causing the spike, and is there anything state officials can do about it now? So we're talking with Health Secretary Designee Andrea Palm. Secretary, we appreciate your time. We talked about that two-day spike. What's the reason behind this, do you think?
Well, I think there's a number of things we certainly are tracking very closely. One, as you mentioned in your intro, is the impacts that potentially the removal of Safer at Home and people starting to circulate more, to have more interactions amongst larger numbers of people, right? Previously, we all were just sticking to our family units, to a small subset of folks, and now people are starting to circulate more, which certainly increases the likelihood that they are coming into contact potentially with someone who's infected. But I also think we are testing at a much larger volume, and we also broke records recently, reaching more than 10,000 tests in a single day. And so we expect to see more positives as we increase the number of tests as well.
And I know that percentage of tests is an important figure there, but we also saw a record number of deaths last week. We also see the number of hospitalizations growing, which I don't think that really goes along with the percentage of cases. So, I mean, can you for a fact trace this back to the stay-home order being lifted? Is that even possible?
Mm-hmm. Yeah, I think, what Dr. Westergaard would say is that it is not easy to make a direct connection between the lifting of Safer at Home. But what we do know is that this virus is very contagious, and our ability and the work that we did together as a state to flatten the curve was as a result of people really limiting their contact with other people. And so it is not surprising as the state opens up more that we will see increases in infections as more and more people come into contact with each other.
What are your projections then for the summer, for the next few months?
Mm-hmm. Well, I think one of the things that we have seen, again, Wisconsin did a great job. The state really pulled together and did a great job in flattening the curve and in protecting as many folks and reducing the number of deaths to pretty low numbers. But we certainly expect as the summer moves on, whether or not there's a surge in the fall, I think we have to continue to be vigilant together to do everything we can to protect ourselves and our neighbors and our families by doing common sense, smart things to limit our interactions with other people, because the virus is still here. Until we've got a vaccine, we are still going to see the spread of this disease and infections. And so Wisconsinites have risen to the challenge, and I think we'll continue to do the work we need to do to keep as many people safe as possible.
So many things have been canceled this summer. Any idea when we could get back to some of those events safely?
Mm-hmm. Yeah, I think the governor says well that the virus dictates our timeline, and I think we still don't know a lot of things about this virus, right? It's speculation about whether there'll be a surge in the fall. It's speculation about how this will continue to evolve, and so I think it's too soon to say where we'll be in the fall. But right, we control a lot of that by how we interact, how seriously we take precautions over the next several months to set us up for the fall. And so we have to continue to do the work that needs to be done to protect ourselves and protect our families while we ramp up testing further, while we ramp up contact tracing, while we put in place some additional tools to help us really box this virus in.
Wisconsin is now reporting some suspected cases of this rare inflammatory syndrome in kids that is linked to coronavirus. What can you tell us about those cases? That's a scary thing for parents.
Yeah, it sure is. Right, we saw this this first cluster in New York, and now the nation has gone on alert to be on the lookout for it in kids in their own states and communities. And sort of like the way that vaping unfolded nationally, our connection at DHS with providers all around this state and understanding what the signs and symptoms of this rare inflammatory disease are, and working closely with them to make sure we are understanding and identifying kids as quickly as possible with our partners at Children's and other places around the state. Should they see suspected cases, will allow us to intervene quickly, help provide the kind of assistance and expertise that we can to help those doctors on the ground treat those kids as effectively as possible. But this is certainly a new wrinkle in this virus, and one that we have to be really vigilant and watching out for, so we can take care of our kids as quickly as possible as this thing continues to evolve.
Do you know how many cases in Wisconsin so far and how severe they are? Because most kids recover from this, but unfortunately some don't.
So what I do know, Adrian, is the universe right now is 7 cases. What I don't know is the split between suspected and confirmed, but we are working with Children's Hospital on a total of 7 possible cases. Some of them have been confirmed, some of them we continue to look at, but we are in close contact. They are great partners and have been great partners, and we will do everything we can to support them in making sure these kids get the best treatment that we can.
So you still have the title right now of designees. Some Republicans, they say they don't want you confirmed. Some even want you to resign. Have you given any thought to resigning? Is that even a consideration for you?
Yeah, I mean, this pandemic is pretty all-consuming. I get up every day. The mission of this agency is to protect and promote the health of the people of this state, and it is what we do. It is what the team is doing. It is what our statewide response is doing, and it's what we will continue to do, because that's what the people of the state expect us to do. And we are certainly committed to getting through this pandemic and saving as many lives as we can and promoting the health of the people of this state.
And I want to give you the chance to respond to this, because Senator Fitzgerald, the Senate Majority Leader, came on the show and he said that he would like you to go before the Health Committee to answer some of their questions. Is there a status update on that?
So we have been providing regular updates to the legislature. The Department of Health has, other departments across the government, the governor's office. We certainly have been transparent and accessible to them, as well as to the public through our website and through our regular media briefings, and we'll continue to do that moving forward.
All right, State Health Secretary Designee Andrea Palm, we really appreciate you making time for us.
Thanks, Adrienne. Appreciate it.
My interview with Andrea Palm continues now on our website. I ask her if she would have extended the stay-home order again if she had the power to do so. You'll find that on the upfront section of WISN.com. Coming up.
I'm nervous because I want our guests to feel comfortable, and I don't know when we're ever going to reach that point again.
Some restaurants are reopening, but a few are closing. Next, an industry expert on the challenges facing restaurants and keeping people safe as they get back to business.